May I now call on stage the organizing secretary of this conference, Dr. Manishi Bansal. He is UP State Representative to the Indian Orthopaedic Association and Treasurer, UP Orthopaedic Association. He is also an author, a secret which is soon to be revealed here. I would like to call on stage the organizing chairman, Dr. Kapil Kulshresh sir and Dr. K.D. Tripathi. It is my proud privilege to welcome on stage our guest of honor, Dr. D.K. sir. He is a renowned revision and joint replacement surgeon from Rajpur Hospital, Mumbai, with more than 5 decades of orthopedics in him. He is the author of a landmark book on interlock nailing for orthopedicians, with numerous publications in national and international journals and medical texts to his credit. I will now request on stage our guest of honor, Padma Shri Dr. Sanjay. Ex-Professor in Head, Department of Joint Grant Medical College, Dehradun. He is the founder of the Uttarakhand State Chapter of Indian Orthopaedic Association. Please welcome on stage the chief guest of the conference, Dr. Ram Chatras, eminent spine surgeon from Mumbai, with the most vibrant and valid talk today we just witnessed. He is current Vice President of the Indian Orthopaedic Association. He is President-elect of Indian Orthopaedic Association and past President of Association of Spine Surgeons of India. हम सब इसी भाव से प्रेरित हों और रहें और सविनय निवेदन है हमारा सबसे सभी मंचासीन पदाधिकारियों और सम्मानीय विशिष्ट अतिथियों से to please light the lamp and inaugurate formally the session. Thank you. Secretary, President-elect UP Orthopaedic Association, Dr. Anup Agarwal. Hello. Secretary, UP Orthopaedic. Patron, Prayagraj Orthopaedic Association, Dr. A.N. Verma sir. Patron, Prayagraj Orthopaedic Association, Dr. D.C. Srivastava sir. President, Prayagraj Orthopaedic Association, Dr. Nikunj Kumar Agarwal. And Secretary, Prayagraj Orthopaedic Association, Dr. Sachin Yadav. I will request Dr. Manishi Bansal to please take center stage for the unveiling of his book.
अंदर पूरे में घुमा देना एक बार। बदल पाए तो
Thank you so much. I will now request Dr. Manishi Bansal to please propose the vote of thanks. And though pictures speak louder than words, as Dr. Bansal has read in his book, it would be nice if you would talk a few words about your book itself.
इसमें उन सभी का मैं तहे दिल से शुक्रिया अदा करता हूँ। मैं शुक्रिया अदा करता हूँ अपने मीडिया कर्मियों का, अपने हॉल कोऑर्डिनेटर्स का, अपने न्यूज़ प्रिंट के सारे संपादकों का, जिन्होंने हमारे इस पूरे कार्यक्रम को पिछले 2 दिनों से अपने न्यूज़ मीडिया में और प्रिंट मीडिया में, इलेक्ट्रॉनिक मीडिया में सभी में प्रमुखता से स्थान दिया और जन जागरण तक ये संदेश पहुँचाने को बेहतर तरीके से जोड़ा जा सकता है। मैं उन सभी का हृदय से आभार व्यक्त करता हूँ। मैं आप सभी का एक बार पुनः हृदय से आभार व्यक्त करता हूँ और यहाँ पर आने के लिए धन्यवाद देता हूँ। धन्यवाद।
For this, we have invited a very renowned orthopedic surgeon of this region and Padma Shri awardee, Padma Shri Dr BKS Sanjay. I request Dr Manishi Bansal to read about the citation of Dr BKS Sanjay.
Thank you, sir. As a visiting professor, he has delivered lectures across the globe in Japan, Australia, Singapore, New Zealand, California, Malaysia and USA. He worked as an associate professor in PGI Chandigarh and professor and head of department at Himalayan Institute of Jolly Grant. He presented more than 100 papers in various national and international conferences and published his academic work in top-rated index international journals. He is a founder president of Uttarakhand State Chapter of Indian Orthopaedic Association and a member and fellow of many national and international professional bodies. A renowned surgeon and a social worker, outstanding writer, orator, and a columnist, and an author of a poetry book, Upar Sandesh Ka. Dr. BKS Sanjay has been awarded Kavya Bhushan Samman also. Multifaceted personality, recipient of CCOT Foundation France Award 1996, Dr. Durga Prasad Lokpriya Chikitsak Puruskar 2022, Uttarakhand Ratna 2002, Uttaranchal Gaurav 2003, is renowned in his medical as well as social work. Prayagraj Orthopaedic Association feels honored to bestow the prestigious Professor Suresh Chandra Gaur Oration to Dr. Bhupendra Kumar Singh Sanjay on 13 November 2022 in Platescon at AMA Convention Center, Prayagraj. Thank you, sir.
Yes, privileged people probably will feel very proud. But when we talk in front of the people, those who are many times more than you, especially the teachers. Students can never be equal to the teachers in anything. If in the one field one can be, but not in other. पद, प्रतिष्ठा, प्रशंसा, पैसा, प्यार, प्रोत्साहन, पुरस्कार पाने की सबकी कामना होती है और सबको नहीं मिलता। I would like to thank to all members and office bearers of UP Prayagraj Orthopaedic Association, particularly to Dr. K.D. Tripathi, organizing chairman, and Dr. Manishi Bansal, organizing secretary, and their team, who has extended invitation to me to deliver this oration. Dr. SC Gaur was born on 20th September 1948 in Aligarh, UP. He is exactly on almost 6 years elder than me. He did the MBBS, MS, Orthopaedic from Kanpur, and I entered in the MBBS in 1974 when he was almost becoming an orthopedic surgeon. I never met him in the medical college because I was at that time the first year student, and the first year students were not supposed to go to the hospital. Since 1975, he held various teaching positions and retired as a professor and had in 2008. I had an interaction with him during many conferences. Dr. Gaur was the renowned orthopedic surgeon of his time. He has contributed a lot, not only in the field of clinical practice, but in the academic field as well. In addition to that, he has been a great human being, and I think his achievement, his behavior has led to start an oration on his name. This is a great tribute to any person by his colleague and fraternity to give the oration. I started orthopedic training with the intention to just reduce the fracture and put the plaster for the fracture treatment. Honest statement in front of you. As I have, but I have an intuition at that time that the number of patients of orthopedic fracture will increase coming time. I know when I was doing the house job or so, the orthopedic surgery was not as good or was treated equal to the medicine of the pediatrician. Relatively, before I entered, the people, those who got the less merit, used to go to the orthopedic training also. But there was me and my other colleagues, those who were working with me, we opted for the orthopedic surgery because by entering the medical college, I only wanted to become a surgeon, not the physician. Still today, I consider the surgeons are better than the physicians. But unfortunately, in the English practice, the surgeons are never given the designation of the doctor, but Mr. I was giving a lecture in the San Diego University. The professor who invited me, he asked me, "Are you a doctor?" I feel insulted. I say, "I am a doctor." But he said, "You are a professor." I again said, "Yes, I am a professor." Then he said, "How you are a surgeon?" Yes, I say I am a surgeon. Then he said, "How you can be a doctor? If you are a surgeon in England or in a higher post, you are addressed as a Mr. And this is the tradition. This is started from the why? Because the surgeons were in England. Surgeons were not well qualified people. The only doctors and the physicians were the well qualified, and those who got the recognition from the FRC, but not the surgeon. But after all, because there became a competition between the doctor and surgeon, and surgeons became a superior and they proved that they are better than physicians, then they started to give the honor to the surgeons. But to my surprise, the whole scenario of orthopedic surgery has changed in the last 40 years. Recently, many developments in the management of the fracture treatment have been seen. The management of Hans Wellenegger and the Morris Muller. I met Professor Hans Wellenegger first time in Sweden in 1986 during my Swedish government fellowship, and then again during my AO fellowship in Bern in 1988. I also met Professor Morris Muller first time during my Mayo Clinic fellowship in Rochester, Minnesota, USA. Since then, I have visited Davos in Switzerland many times, which is the headquarters of the AO. AO principle of the fracture management has the three components. First, reduction of the fracture. Second, stable fixation. Third, early mobilization. Joint. The fixation, the absolute stability if it is done in proper way and if fracture is reduced in anatomical position. Locomotion is important at every stage of life. However, it is more important in childhood. Normal walking contributes a lot for the overall development of any child. Like in this girl, you see she is the 11-year-old bilateral CTB corrected fully. Almost it becomes, people can't believe it that this is the same girl. The lady, she is the more than 60 years after the osteoarthritis. This becomes a deformity, become difficult to them, and after the surgery, they have become a normal. Even if I say just in the lighter mood to the daughter-in-law और तो बहू जो आती है मैं बहू से कहता हूँ आप अपनी सास को ऑपरेशन करा लो क्योंकि मैं इसे जवान बना दूंगा तभी तो आप बाजार घूम पाओगे क्योंकि माँ काम करेगी सास तभी आप बाहर घूम पाएंगे और सो पाएंगे और टीवी देख पाएंगे and with this लालच probably the greed they convinced to the mother or mother-in-law अब मम्मी सही कह रहे हैं डॉक्टर साहब ऑपरेशन करा लो वो कहती मुझे डर लगता है कहाँ जाना आप तो बहुत जल्दी जाना ही है तो कहती कुछ भी नहीं जितने दिन रहोगी कम से कम तुम जिंदा रहोगी और इनडायरेक्टली शायद ये भी कहती तो मेरी सेवा करो both knee joint alignment surgery in the bilateral retired teacher. He has decided, Doctor, he has plenty of money. His son is also the principal and granddaughter is also the doctor. They have plenty of money. इन्होंने कसम खा ली कि मुझे knee joint replacement तो कराना ही नहीं. डॉक्टर साहब 14 डॉक्टरों के पास गए सब ने मुझे कहा मुझे तो ये नहीं कराना and they got it and they gave me this letter as well because I can't because due to the lack of the time I can't. Locomotor disability means a problem in the moving from one place to another. That is the disability in the leg. According to the 2011 census, almost 27 crore people in our country were disabled and 20% had the locomotor disability. I believe that the orthopedic surgeon of our country can play an important role to prevent and to correct the deformity. I also believe that the health of the limb is as important as that of the heart and the lungs. Many people are having the heart and lungs lying down in the bed, sitting in the room, not going anywhere, then there is the life. Whatever mankind has achieved so far is mainly due to its ability of locomotion. If all of us had not walked on our feet, we would not have reached where we are today. Because walking is necessary to go to the school. Once we have gone to the school, then limit is unlimited. A healthy and educated person not only can do his work, but the works of the others as well as we are doing. I say them, he-men, in other words, Dabang. Who are the Dabang? Who is the full of confidence because he means H for healthy and E for educated. Once anybody becomes the he-man, then he will be successful. And I add in this, not only the he-man, but when the nation will have the he-woman. What is he? Healthy and educated woman, nation will grow deep and bounce each and every day. Strong bones, strong muscles and flexible joints form the iron triangle that carries the most important load, that is the human body. Interestingly, 50% of the person's bones and the muscles are in the two legs. Both the legs together have 50% of the nerves and blood vessels of the human body. 50% of the blood flows through them. It is the largest circulating network that connects the body. 70% of the human activities in once of the life are done by the two legs. Overall, physical, mental and social, economic development of any individual takes place only by locomotion. Any type of disability causes not only physical harm but also mental, economic and social loss. The needs of the people with disabilities are the same as those of the capable person. You see this photo. This is a snake-like deformity. This patient was abandoned by the family because of the deformity, because he became a liability to the family. And he in fact left the place from Lucknow to Dehradun, and he is one of the renowned mechanics that person is having, because my identity sometimes goes with his identity, because many of these people, those who are coming with the Mercedes and the bigger cars, they know this person. And they sometimes, because I displaced this photo in the reception area, he said, Doctor Sahab, aapne iska hi ilaj kiya hoga? Then they come to know because he is the one. The correction of the deformity should be done as soon as possible. The perception of the community people is that children should be operated only when they become mature. But sooner the correction, better the results. That I have already shown. Growth of any individual depends upon locomotion. We all need a conducive environment to grow and develop in existing environment and circumstances. But disabled people need more. The longer the disability lasts, its ill effect increases proportionately. Government, non-government organization and society should try to prevent any kind of disability. Deformity and disability due to any reason should be rectified as soon as possible, because I believe that the plants can be straightened easily, not the tree. बहुत सी माएं कहती हैं, अरे अभी तो बच्चा बहुत छोटा है, अरे इसको तो ये हो जाएगा, हम उनसे यही कहते हैं, आप बताओ, कब पौधे सीधे होते हैं या पेड़? This boy has got the iatrogenic bowing of the tibia. That fibula has been done for the tibialization, and which is, I presume, it is not should be done in the children, but has been done, and the deformities persisted. These deformities can be corrected in the time, and they corrected as almost normal. And this is the photograph with the difference of the 6 year or so. I would like to say that if the health of the feet of all of us was not good and we were not walking, then we would not have reached where we have reached. In other words, those who are not able to walk will not be able to reach where we have reached. Disabled can only dream, and people who can walk can dream and can fulfill their dreams, as we all have done and are in the pursuit to fulfill them. The certain disabilities and the deformity are the associated since the birth of the child. This unfortunate child lived with that for whole life, but at what cost? I would like to quote an example of the Astava who was having 8 deformities in the whole body. That's why he was named Astava. Because of that deformity, he had been humiliated by the community and the society since birth, by all people of that time, even by his father. He was thrown away and born. The orthopedic surgeons play an important role to correct the deformity and the disability. I think it's a great contribution of all orthopedic surgeons, including Professor SC Gaur, for the growth and development of the society and the nation. जब भी कोई लोग लड़ने आते तब हम इनसे यही कहते हैं तुम लोग तोड़ दो लोग, तुम्हारे बच्चे ने तोड़ ली मोटरसाइकिल को चलाएगा तोड़ेगा, और जब हमारे जैसे डॉक्टर नहीं रहेंगे तब क्या करोगे? जिंदगी भर लड़के को लगड़ा रखोगे? कोई गलती हो जाती हम और आपको ब्लेम करते हैं। कभी हर माँ बाप से पूछता हूँ, कभी आपने बच्चे से कहा है बात कि आपसे गलती हो गई, उससे इतनी बड़ी गलती होने पे आप उसे एक्सक्यूज कर देते हैं, और डॉक्टर से कोई छोटी सी भी गलती हो जाती है। I tell you only one example. 5 people were traveling. 2 died at the spot of the accident, 2 died on the way, 1 died in the hospital. Then they break the hospital. Abuse us, damage our property. When all 4 died, nobody has complained to anybody. But for that person, when we are trying to save him, if he died, then they scold us or they abuse it. Fracture has been an important cause of deformity and disability, which has been corrected by the early or delayed osteosynthesis, and the plates have played an important role to fix the fracture. I have seen significant development in practice of fracture treatment since 1980, which is now more than 40 years since my start of orthopedic training in PGI Chandigarh. Plate osteosynthesis can be done in any part of the bone. However, recently the nail has taken over the osteosynthesis of diaphyseal fracture almost. However, the metaphyseal and intra-articular fractures need to be fixed by plate only, as many speakers have shown this. This is the patient who has been treated, and this is the patient. The left side I have treated, the right side others has treated, and you can see in this with the 2 screws in the sacroiliac joint. मैं इसके लिए सिर्फ यही कहूँगा, रहमन देखिए बड़न को लघु न दीजिए डाल, जहाँ काम आए सुई कहा करे तलवार. If you go in the detail, the following 25-year-old polio-affected patient with similar fracture was treated elsewhere with extensive 2-stage procedure. The patient developed further paralysis after surgery. Polio है, पहले ही करेगा, फिर उसका नींद चला. An important advantage of the plate osteosynthesis is the anatomical reduction, which is most important for the normal function of the joint and the limb. This is the one of the patients treated with the plate, 25 years old, unmarried at that time, sitting, doing all job at that time unmarried, now he is married, and after the 3 years of the surgery, these are the photographs. Wrist fractures or any intra-articular fracture, they need the plate fixation, and that is the best. The judicious use of osteosynthesis with the plate is many times better than the osteosynthesis with the nail. The use of plate osteosynthesis have improved a lot after the minimum invasive surgery or the minimum osteoplate synthesis, and the availability of the pre-contoured plate and of the image intensifier almost in all orthopedic operation theaters, as we are discussing in the morning as well. Very soon, probably all orthopedic surgeons will have to have the portable CT scan, because the way our skills are increasing, our expectations are increasing, the aspirations of the patients are increasing. Probably we should have the arrangement, or we should plan like that way, that all orthopedic surgeons should have the CT scan to improve the quality of the surgery and the quality of the result. The improved quality of the material has also played a significant role to prevent the breakage of the plate, which was quite common in the early scene, or the many people of my age might have seen. I personally think the breakage of the plate is not mainly because of the poor quality and the design of the plate, but if the plate is already put on the bending surface rather than on tensile surface of the bone, then it is bound to fail or break sooner or later. Sometimes it happens even with the non-weight bearing activities or exercise. It is bound to break definitely, particularly if it is not protected till the consolidation of the fracture. If not the plate, then the bone, as it can be seen in the following slides. The slides you see, plate is not on the lateral side, but it is on the anterolateral side. And in this plate, it is bound to break, and if particularly the poor quality, then it is bound. Whatever newer development has been achieved in the fracture management, the management of the fracture with the plate osteogenesis were relevant in the past. This is the slide. This procedure has been done 1988, and this is done in the Himalayan Institute. And this is the open fracture, multiple fracture. At that time, because the open fracture, we were afraid to put the nail, and this the plate has been done. And whatever can happen in the plate, that also patient has got the internal fixation at the primary site at that time, or I suspected that it is bound to fail, so I put the bone grafting, then got the infection, suction irrigation for infection, bone graft, repeat bone grafting for the delayed, but it healed. Plate osteogenesis is still relevant, especially in the certain situation like fracture through hip or knee implant or knee implants. Like over here, the one of the speaker has shown one in the through the plate or above the plate. It is the simple procedure, and that very well, because the revision of the implant, certain time this patient doesn't want that I will do it, I like it, the revision of the hip, even if you do it, it's going to bound to fail the infection and the loosening, all the things. So this is the simple procedure, and it solves. It is still relevant, especially in certain situations like the neovascular injuries. I have done it because being an orthopedic surgeon, being in the training in the Mayo Clinic, I had the training to do the vascular surgery as well. I repaired this brachial artery and put the plate at that time, healed, and this is the result. It is still relevant, especially in the metaphyseal, in the intra-articular fracture, and this is one of the slides. He has got the all fracture, complete rupture of the quadriceps, from patella, partial peroneal tendon avulsion, axial avulsion, lateral meniscus injury, and the other and obese patient, and this is what is the procedure. The open procedure and multiple plates, multiple surgery, then it can be salvaged in this. To achieve the anatomical reduction and a normal physiological function of the joint, so that the patient can have pre-injury status. Say the plate gives the almost anatomical reduction. You can see in this slide, and you might have got your own experience. Same over here. Extensive fracture, but the nail is bound to fill, especially in the distal. It is going to give the either this angulation, medial, lateral, rotation, all the things. So closer to the joint, I personally feel should be done with the plate only, though there is the risk of the infection, stiffness, knotty, and this happens. But still, it is the better. If it works well, then it is going to work better. To achieve the anatomical reduction, normal physiological function of the joint, so that the patient can get the pre-injury status. It's the elbow. It's also done in sometime 2008. This is the another knee injury. Nowadays, I put the two plates on the both sides, medial and lateral. Don't take chance in anything. The plate osteogenesis got the fewer inherent complications like increased chances of infection due to larger soft tissue dissection, depend upon the size of the plate, as I mentioned earlier. Increased chances of delayed and non-union due to distraction and avascularity of the fracture ends, which happens sometimes, but now these both problems have been rectified or taken care by the minimum invasive surgery or the NIPO. I would like to mention a quote of Professor Morris Muller: to anticipate, recognize and understand mistake is the principle of the wisdom. मैं सभी से सिंपल भाषा में कहता हूँ, यदि मुझे सड़क में गड्ढा पता हो, पहले से पता हो, तो क्या मैं संभाल के नहीं चलूंगा? जब सडनली लग जाता है, even I put the brake, still I cross that hole. Complication of the plate fixation can be reduced with the careful soft tissue handling as well as the anatomical reduction, stable fixation of the fracture, aseptic surgical precaution, and meticulous surgery. I personally feel in our country, people do not give us as importance to prevent the infection as they do for the other things, like patient prefer imported titanium expensively. That's a plate of titanium is done. But they do not give the importance of the no cost or least cost principle of the general hygiene and the surrounding cleanliness. I एक और बताऊं, डॉक्टर साहब पैसे कम कर लीजिए, डॉक्टर साहब सर्जरी कम कर लीजिए, और प्लेट डॉक्टर साहब इम्पोर्टेड ही डाल, टाइटेनियम की डाल, वो 50,000, और डॉक्टर साहब 50 की क्या 75 की डाल दीजिए, उससे उसे कोई फर्क नहीं पड़ता, because that is the concept or this is the thinking of the people. लेकिन ये नहीं जानते लोग, हर अमीर आदमी पत्थर मकराना से ला रहा, लेकिन हर घर ताजमहल नहीं बन रहा। क्यों? क्योंकि कारीगर नहीं मिल रहे। देश को चलाने के लिए पत्थरों की नहीं, आदमियों की जरूरत है। हमने कविता लिखी हुई है, सर्जन शुड गिव इंपॉर्टेंस टू द सर्जिकल प्रिंसिपल रादर देन इम्प्लांट मेक एंड मटेरियल व्हिच इज इमटेरियल। Factors influence the results of any problem because there are 4 factors: severity of the fracture, earning of the patient, facilities and skill. यदि देखिए इंदिरा गांधी को चोट लगी, इतनी सीवियर चोट थी, बच नहीं पाए। मिस्त्री जी का एक्सीडेंट हुआ, दिस वाज सो एक्सपेंसिव। जिस हॉस्पिटल में पानी की सुविधा नहीं, वहां पे ब्लड की कहां सुविधा होगी? और जहां पे डॉक्टर की स्किल, बिकॉज हर चीज में कहीं ना कहीं हमारे देश में कोई ना कोई मिसमैचिंग है। पैसा, मैं सबको ही कहता है हेल्थ इज वेल्थ, मैं कहता हूं वेल्थ इज हेल्थ। पहली आप स्लाइड दे दिए, जो चल रहा है बंदा, इसने आप 8,000 रुपए लेके आया, प्रोसेस कराना चाहता है, हिप को ठीक कराना चाहता है। दिस इज स्लाइड हैज बीन टेकन सम टाइम्स इन द जॉली ग्रांट ऑलमोस्ट 20 इयर्स बैक। और उसके पास इतने पैसे नहीं थे कि प्रोसेस ऑपरेशन तो कराया, ब्लड का भी इंतजाम है। दूसरे आदमी को फ्रैक्चर नेक हुआ, एनेस्थेटिक्स को दिखाया, कहता कार्डियक प्रॉब्लम है। उन्होंने उसको कहा डॉक्टर साहब हम तो नहीं करा पाएंगे, इसको गंगाराम भेज दीजिए। गंगाराम में बाईपास किया और वहीं पे कलरा ने प्रोसेस भी डाल दी। दोबारा इनको फ्रैक्चर हुआ, हमने भी कर दिया। एंड दैट इज द डिफरेंस, दैट्स व्हाई आई से वेल्थ इज हेल्थ। किसी भी काम के लिए टीम वर्क का है। व्हाट ए टीम कैन अचीव, इंडिविजुअल्स कैन नॉट। ये 2 पिक्चर देखिए सर, बैंकॉक से लाया हूं। और दूसरी स्लाइड का एक्शन देखिए और इससे अंदाज लगाइए, ये काम भी बिना टीम के नहीं हो सकता। And I have also given a one draft. Do right at the first time because repair and redo are costly affair. जितना भी टाइम लगे, मेरे से एक मरीज कहता है डॉक्टर साहब कितनी देर में होगी? 1 घंटा। दूसरे दिन फिर ऑपरेशन थिएटर, कितना दिन लगे? यार मैंने कहा एनेस्थीसिया लगेगा, आज शुरू करूंगा, कल खत्म करूंगा। डर गया, कहता मुझे ऑपरेशन नहीं कराना। लेकिन मैंने ये कह दिया भाई मैं तो ऑपरेशन ही करता हूँ, जब तक अच्छा नहीं करता हूँ तब तक करता ही रहता हूँ। Locomotion has been important system work of the human being because it is said in our scripture and we know ourselves that the annam by prana, that is food is life. For the search of the food we need normal locomotion. We humans have gone from one place to another place only for the search of food since the origin of the mankind. The situation is more or less same even today for the majority of the people. We all are moving from the search of the food or employment. Therefore, the health of the limb is as important as that of the heart. It is also said, चराति चरतो भगा, अर्थात चलने वाले का भाग्य चलता है. In other words, those who walk, their destiny is walking. In addition to my orthopedic practice and academic work, which I have done all these fellowships and presented the paper, visited the university, delivered the lectures. In addition to my orthopedic work, to spread the awareness, I do program on the radio, TV and write columns for magazine and newspapers to spread the awareness about the various health related social issues. This is the one of the high toll road accidents in India, human and economic loss. The link between the poverty and road traffic accident. हर आदमी गरीबी से गरीब होता जा रहा है। मेरे कहने का मतलब बिल्कुल साफ है, मिस्त्री जी का भी एक्सीडेंट होने के बाद उनकी फैमिली भी गरीब हो गई। This I wrote this articles and the awareness program. For that the India book has recorded, and for this guest column International Book of Recording, I have written a poem on locomotion with the charati charte bhaga, keep walking, I would like to recite it. इच्छा से जन्म होता है कर्म का और कर्म से फल का, फल से फिर नई इच्छा का। जीवन भर यही चक्र चलता रहता है और यही चक्र देता है गति और यही देता है प्रगति। जीवन का यही है सार्वभौमिक सत्य, गति ही जीवन है, ठहराव है मृत्यु। सनातन जीवन में प्रतीक का महत्व है। आज लोकतंत्र में भी प्रतीक का महत्व है। हमारे राष्ट्र ध्वज में भी एक प्रतीक है नीला चक्र अशोक का, जो प्रतीक है धर्म का और कर्म का, जिसका हर किसी भी स्थिति और परिस्थिति में एक है संदेश, चरे बेती अर्थात चलते रहो। क्योंकि चराती चरतो भगा अर्थात चलने वाले का भाग्य चलता है। जिस तरह आजादी के पहले देश का एक संदेश था विदेशियों के लिए, भारत छोड़ो यानी चले जाओ। आज आजादी के अमृत महोत्सव पर संदेश है देशवासियों के लिए, चलते रहो। यही हो हम सबका धर्म, यही हो हम सबका कर्म, बढ़े हम स्वर्णिम युग की ओर, जहां हो शांति और समृद्धि। चरे बेती अर्थात चलते रहो। कीप वॉकिंग। As I mentioned, I have written a poetry book, Upahar Sandeshka, which has been published by the Bharatiya Jnanpith. I would like to recite a 2-minute poem for this as well, and that is the end of the. Unfortunately, I can't do it, but I have the book, so I will finish over here only. Thank you very much once again. The UP Orthopaedic Association and Prayagraj Orthopaedic Association, who has invited me to deliver Dr SC Gaur Oration in the holy city of Sangam sacrifice. I would say few lines about जैसे जैसे सपने बढ़ते हैं वैसे वैसे जीवन बढ़ता है. मैं तो कहूँगा सपनों को बुनो, पालो, पोसो, बढ़ाओ अपनी पूरी लगन और मेहनत से, क्योंकि सपने ही तो भविष्य है हमारा आपका. हाँ, सपनों को पूरा करने के लिए दूसरों का सहयोग दो और दूसरों के सपनों को पूरा करने के लिए अपना सहयोग दो, क्योंकि जीवन का आधार ही है सहयोग. सहयोग के बिना हम सब की उत्पत्ति नहीं हुई होती, ना ही होता इतना विकास एवं विस्तार. आज यहाँ पूरा हो रहा है, ये सपना ही तो था और क्या. हमारे सपनों को संभालने के लिए आपको धन्यवाद और आपके सपनों को संभालने के लिए हमारी शुभकामनाएं.